The hand is a very complex area. There are 27 bones, 27 joints, 34 muscles, and 100 other soft tissues in the hand and the wrist area. So there's a lot going on. So when we map an area, before we map it, we really want to make sure that our examination is very thorough, very complete, along with the history, and if necessary, that we have diagnostic testing to make sure that we're localizing and we know where to go. So to further that, we are going to map. This will get us to a closer location to where we need to be, or more precision, even with imaging, because it's a small area. We are going to start on the back side of the hand, or the dorsal side of the hand. And we will go to the palmar side, because just as we did with the foot, or we will do with the foot, it's very important to get both sides. So for mapping, support the hand completely and the fingers. We want to go from the wrist out to the 5th digit, back to the wrist to the 4th digit, back to the wrist to the 3rd digit. And you'll notice I'm going all the way out the digit, all the way out. And then we hit the thumb as well in the posterior joint capsule of the thumb. As I said before, our orthopedic assessment and our history on our diagnostic imaging will give us the area that we need to focus on, but the mapping is really helping to localize that and lock it down. So after we do our mapping of the wrist and the hand, we will then flip the hand over and repeat again, grasping the ends of the fingers just a little bit, and then covering the palm of the hand, the wrist, and then out to each finger. And make sure that we have enough gel to get that done. So you can break that up into 2 parts. I usually just do it by flipping all the way back and forth. This way we're covering everything in the fingers, everything in the hand, and as we come back, everything in the wrist for the mapping. Of course, we're listening for the feedback from the patient, or if there's any wincing of or her pulling her hand away, which would indicate that there's a hot spot or an area of pain and inflammation that we would need to treat.